Hello, I'm Dr. Cheryl Lindy. I'm Administrative Director for Professional Practice, Research, and Education at CHI St. Luke's Health. And I am going to spend a little time with you discussing certification. We'll discuss the benefits of certification, the barriers to certification, and some strategies that one can use to overcome those barriers. Some of the benefits of certification are, first of all, the intrinsic. The nurse feels better about him or herself. They have a higher self-esteem. They have a sense of accomplishment. To be able to study and achieve something definitely gives a sense of accomplishment. It validates their knowledge in the specialty that they've chosen. They have the increased confidence in their clinical skills. Some studies have shown that it actually increases nurses' empowerment as they become certified. It demonstrates professional growth, and some studies have actually shown that there's higher job satisfaction in nurses that are certified. The extrinsic barriers or extrinsic benefits are it increases one's credibility to peers and others that they interact with. There's recognition from peers and employers. There is reimbursement for certification and recertification. It increases the nurse's marketability if he or she chooses to seek additional or different employment. And some studies have actually shown that patients' confidence increases when they know that they're being cared for by a certified nurse. The organization also benefits from having certified nurses. It demonstrates that nurses have shown initiative to develop their knowledge, and that they're committed to increasing their ability to practice in their chosen specialty. It also validates the nurse's knowledge. Studies have shown that nurses have increased confidence in the decisions that they make about patients and the care that they provide. They perform slightly higher in planning and evaluation. In addition, there's a tendency to have a higher performance in teaching and collaborating with others on the healthcare team. A component or a key component to many of the recognitions that organizations seek, such as Magnet, Beacon Award for the critical care areas, Baldrige, and even the U.S. News World and Report ratings identify identify certification as a key component for better patient outcomes. In the 2014 Magnet application model, one of the sources of evidence that has been for a long time in the Magnet is that organizations are required to set goals for development or increased number of certified nurses. A change with the 2014 manual is that now organizations need to have identified departments or units that also set a goal and accomplish that goal in having professional certification. There is some limited evidence about the impact on patient outcomes. There are some studies. The studies have been fairly small, and Boltz identified that there was some lowering of patient falls, pressure ulcers, and restraint usage. Coleman found, and this study was done with oncology nurses, that there was a higher patient satisfaction with the management of nausea and pain. Some of the barriers associated with certification, first of all, is fear. One has fear of taking the test or fear of failure. I remember when I took my certification in staff development, I was taking the test written with a number of my colleagues, and so it would have been quite disappointing if I would have failed, knowing that there were about 20 others that were taking the same test at the same time. Cost. The cost runs anywhere from $300 to $450, which can be a significant chunk of change for one to shell out. there's the time to prepare. Nurses have busy lives, and so to take the time to prepare is sometimes very difficult. Lack of recognition and rewards. Many organizations have failed to implement plans to be able to really recognize and reward the nurse of their accomplishment. Another barrier is the lack of experience. Depending on where one nurse practices may mean that he or she is not exposed to all the content areas that would be discussed on a test. And then there has been some written about the barrier to recertification. Now, one would think that after a nurse has prepared to take the certification exam, that it would just be a natural evolution that they would continue to seek recertification. And it's been found that the nurses do not recertify because they feel that there's really no value. There's the lack of recognition, and the cost has continued on, and in some cases has increased from their initial certification, and maybe they are not employed in that same specialty area. So as organizations move forward, they really need to look at strategies to overcome some of these barriers. The first is role modeling. The leadership in the organization should be certified. If not in the clinical area, they should seek certification for administration. To also incorporate the requirement for certification in recognition programs such as the clinical ladder or on performance appraisals, something where the nurse is actually recognized for taking the initiative to become certified. There should be financial support, rewarding the nurse for taking the test, paying for the examination fees, the preparation for the certification. Offer preparation courses or prep classes at the organization, either live classes or online classes. Consider adding the credential to the badges. And there is some hesitation on that just because patients question what are those additional initials after your name. Display certificates in public areas or produce a plaque that has the nurse's name and the certification they've achieved. Celebrate success. Remember, this has been something that the nurse has undertaken and has demonstrated the initiative to continue their lifelong learning. And comfort those who may need to take the test over again. And lastly is to offer them mentors to help them prepare. Thank you.
My name is Ann Gutierrez. I am an Education Resource Specialist 3 at Tier Memorial Hermann here in Houston, Texas. My certifications are, I am a certified rehabilitation registered nurse. I have a certification in neuroscience as a neuroscience registered nurse. And I also have another certification as a certified brain injury specialist. I feel that it is important to seek certification personally as a way of demonstrating my expertise in my chosen fields of neuroscience nursing and rehabilitation nursing. It has given me that opportunity to increase my knowledge in many different ways that I might not have sought to increase it through studying and preparing for each one of these exams. In the Code of Ethics for Nursing, it states that as nurses, we should seek to continue to develop and grow as nurses, not only in knowledge, but in the care of our patients. And in order to do that, certification is one way of seeking that information. Also, the Code of Ethics encourages nurses to be professionals and to encourage others to. And if we don't encourage our co-workers by first setting the example, then they will not continue and they will not follow in our footsteps. And also as an educator, I feel that that is one of my primary roles as a nurse educator, is to seek ways to help those other nurses in the fields of nursing to seek that. In 2001, the American Nurse Credentialing Organization for Certification in the United States did a white paper called Safeguarding the Patient and Nursing Profession, in which they talked about the importance that certification in general in any of the different specialty fields is really important in providing safe care for our patients. In another article written in the American Journal of Nursing in 2001, the nurses that were interviewed that were certified stated that they felt like because of their certification, they were more knowledgeable about the care of their patients. They were able to recognize problems that their patients were experiencing, even sometimes prior to that patient really having a problem with that problem. They also stated that they were able to prevent complications by having the certification. In another article written, study done by the Association of Rehabilitation Nursing in 2007, they also were able to demonstrate increased safety among patients when those patients being cared for from nursing that have their certification. Therefore, showing that even the patients with a higher acuity receive better care if the nurses were certified. In a study in 2013, which was done on medical surgical units, they also demonstrated in their study that the patients received safer care, and in audits done, they found that the nurses with certification demonstrated that their safety care for their patient was at a higher level than those nurses without certification. Also, I feel that it is important for nurses to be certified as their own reward and their own professional development and their own self-esteem, because I feel like that certification gives me that feeling of being just a step above other nurses because I have prepared and I have taken the exam. What are the barriers for nurses wanting to be certified? One of the biggest barriers is the cost of the exam. They're quite expensive, and most of the times the nurses have to pay prior to taking the test, and in many facilities they do not get reimbursed for the examination. Another reason is the fear of the exam, fear of failure, that they won't do well. So therefore I feel as certified nurses, we need to help them in this area and help them be prepared for the exam. The other reason that many nurses say that they do not want to become certified is there's no reimbursement for the certification, no rewards, no system of increased pay by many facilities. So therefore, why do it if there's no reason for me to do it and I put in all this time and effort? Did I make it?
Good morning. I'm Dr. Vivian Dawkins. I've had my certification as a nurse executive advanced since 1990. I tested out for my certification just a few years after they began the certification. American Nurses Credentialing Center started the certification process as a project of the American Nurses Association back in the late 80s, and the original intent of certification was to identify those nurses who had developed exemplary practice skills beyond the knowledge they gained in their basic nursing education programs. It was originally developed to be a practice acknowledgement, an acknowledgement of skills and competencies acquired in practice, not necessarily additional knowledge. As the advanced practice nurses grew in this country and the whole focus on advanced practice nursing grew, then the certification also grew. The certifications grew into specialty organizations. They became not just an example of one's specialty competency and skills, but also then became an example of additional knowledge acquired in order to become competent in a specialty area. Ultimately, the ANCC developed what they call board certification, so that we're not just certified through ANCC, we're board certified. And so the credentials at the back of your name changed. And they added the B to indicate that we were board certified, so that the testing reflected both your skills, your competency, and any knowledge acquired. At this point, many of the ANCC exams still require 2 years of practice before you can sit the exam. The APRN exams and some of the other specialty exams require education. For instance, if you become an NP now, before you can practice as an NP and get licensed in your state to practice as a nurse practitioner, you must also sit the certification exam. So they go hand in glove with the end of your education. Certification was designed originally just to acknowledge skills and competency in practice. They have grown, certifications in all specialty areas have grown to now be an exemplification to the public that you're not only skilled and competent, but you're also knowledgeable. You have gained additional knowledge in your field, in your specialty field. The skills, knowledge, and competency reflect your devotion to patient safety, your devotion to quality performance, quality improvement, as well as your additional knowledge in your field. There has been evidence-based practice research studies in the last 10-15 years that have demonstrated both that mortality and morbidity decrease when you have additional bachelor's degree nurses on staff, but they also decrease when you have additional certified nurses on staff. Whether the certification came with a degree like the APRNs or whether it was in addition to a degree already acquired. When you have more certified nurses and you have more baccalaureate prepared nurses, the safety of the patients in your hospitals goes up and the morbidity mortality rate goes down. So magnet, for instance, the magnet designation reflects that certification is an essential element toward improving the nursing quality in the hospitals. And they're looking now toward mandatory certification of approximately 60% of your nurses. That's what they're wanting in their magnet designation. Reflecting the Future of Nursing report in 2010, they're also looking for 80% baccalaureate nurses in magnet designated hospitals. They don't necessarily go hand in hand, but certification reflects that commitment that nurses have to lifelong learning and to increase and expanding their competency, skills, and knowledge in their field. Barriers to acquiring certification amount to money. Who's going to pay the cost of the certification? The biggest barrier is just getting ready, getting prepared for it. Is there an available refresher course? Is there an available preparation course? If there is, who's going to pay for it? Will you get the time off? Barriers have to do more with time and money than they do, I think, any other one given single thing. A second barrier, though, would be just the knowledge that nurses have of why it's important. So if they don't consider certification to be important, they're not likely to seek it. So if I were to say there were a couple of barriers to gaining certification, it would be lack of knowledge of nurses and executives about the importance of certification and what it reflects, what it says about the nursing staff, and then time and money.